Hi, I am Myla J.C. Cantoja, first-year nursing student at Central Mindanao University, and today I am going to demonstrate the procedure for vaginal instillation. But before that, we're going to do an assessment, which is to assess the external genitals and the vaginal canal for redness, erythema, edema, drainage, or tenderness, and also to assess the patient for any allergies. For the possible nursing diagnosis, we have deficient knowledge and risk for impaired skin integrity. For the materials, we're going to be needing water-soluble lubricant, washcloth, gloves, and of course, the medication. And since we're all set, we're going to start with the procedure. Procedure number 1 is to verify the practitioner's order. Know why the client is receiving the medication. This helps in identifying errors that may encounter during the administration. For procedure number 2, know the actions, adverse effects, side effects, and nursing responsibilities related to the drug. This aids in evaluating the therapeutic effect of the medication in relation to the patient. Medicines primarily delivered by intravaginal administration include vaginally administered estrogens and progesterones, and also antibacterials and antifungals to treat bacterial vaginosis and yeast infections respectively. For procedure number 3, wash your hands. Since I already washed my hands, I'm going to apply alcohol-based hand rub. This is to prevent contamination and the spread of microorganisms. Procedure number 4 is to prepare or gather the supplies and check the medications. This is for error-free medication. Since I already gathered the necessary materials for the procedure, we are now going to proceed to procedure number 5, which is to compare the doctor's order with the medication ticket and the medication ticket with the medication itself. This is to ensure that the right patient receives the right medication. I'm going to compare it now. They are all confirmed. And now we're going to proceed to procedure number 6, which is to check the expiration date of the medication. This is to ensure the safety of the patient. So the expiration date indicates that it's going to expire on 5/2022, which is on May 2022 next year. So it is still issuable. So now we are going to proceed to procedure number 7. Perform the standing 3 checks of the drug together with the medication ticket. When it is taken from the medication cart, before preparing the medication and after preparing the medication. Since I've already checked a while ago, we're not going to check now. And this is to double check the medication before administering the medication to the patient. For procedure number 8 is to prepare the medication and the necessary supplies. Since we've already prepared the necessary supplies, we're now going to proceed to procedure number 9. Transport the medication using a tray and the necessary supplies to the patient's bedside. This is for us nurses to have an easy access to the medication itself. Let's go. Hi ma'am, I am Myla J.C. Cantoja, your nurse for today. Pwede na ko baybalan yung pangalan ma'am?
Nolita Cantoja,
Ano sa yung birthday ma'am?
September 28, 1963.
Okay ma'am, thank you ma'am. So this is for procedure number 10 and number 11. You need to introduce yourself and identify the patient. This is to establish a report and the cooperation of the patient. And also, it ensures that the right patient receives the right medication. So now we are going to proceed to procedure number 12, which is to explain the procedure and the actions of the medication that you're going to give to your patient. This is to reduce anxiety and stress and also to assess the capabilities of the patient itself to assist you in doing the procedure. So, ma'am, medicines primarily delivered by intravaginal administration include vaginally administered estrogens and progesterones and antibacterial and antifungals to treat bacterial vaginosis and yeast infections respectively po, ma'am. So that is the procedure that we're going to do with you, ma'am. Procedure number 13, you need to provide for the client's privacy. This is for the patient's safety, security, and their comfort itself. So we will now proceed to procedure number 14 since we've already secured the area, we've already closed the curtain and the door. We are now going to proceed to procedure number 14, which is to wash your hands, don gloves, and use a double gloving technique. This is to prevent the spread of microorganism. And now we're going to, since I've already washed my hands, I am now going to apply alcohol-based hand rub and apply the gloves. We'll now use a double gloving technique. And now we're going to proceed to procedure number 15, which is to position on dorsal recumbent position the patient and do a diagonal draping. This is for easy access and for the privacy of the patient. Now going to apply the diagonal draping. Procedure number 16, remove the soiled diapers and underwear of the patient. This is for their hygiene. Now we're going to dispose this. And prepare a new diaper or an underwear. This is for the patient's comfort and safety. We've already prepared the underwear here. We're now going to proceed to procedure number 18, which is to offer a bedpan lined with plastic and towel. This is to maintain cleanliness and orderliness. Here, help the patient. Sideline position. And wait for the patient. Now we're going to proceed to procedure number 19, which is to do a perineal care. This is to ensure the cleanliness of the vaginal area of the patient. Now we're going to clean the perineal area. And now we're going to proceed to procedure number 20, which is to remove the outer gloves. This is to prevent the spread of the microorganisms. Careful not to contaminate the inner gloves. fingers. Now we're going to dispose this. And now we're going to proceed to procedure number 21. To lubricate the applicator or suppository, we're going to use a suppository, and this is for easy entering of the tube in the vagina. And for procedure number 22, you need to retract the labia minora and the majora and insert the suppository applicator 2 to 4 inches. This is to prevent the contamination of the tube from the vagina and the vagina debris in the surrounding area. Magkano ka man? And after that, you need to ask the patient to remain on the supine position for 5 to 10 minutes. This allows the absorption of the medication in the vaginal canal. Ma'am, stay lang po muna kayo sa ganyan na position, ma'am, because para makuan ang medicine of tarum, ma'am. And now, we're going to do an aftercare to the patient, which is, it ensures the patient's comfort and you're going to give the patient a new diaper and underwear. And after doing that, you need to remove your gloves, your first gloves. This is to prevent contamination. And after removing the gloves, you need to perform a hand hygiene to prevent the spread of microorganisms. And for the last procedure, you need to evaluate and document the care that you have given to your patient. This is for their record and the medication progress, so that we may see their progress. And before you leave, don't forget about the materials that you use during the procedure. And that ends our procedure for today. Thank you for watching.